Base Art is a program that's trying to bring the arts into healthcare. The really unique thing about Base Art is that it's actually run in conjunction with a major infrastructure project, which means we're basically getting a new hospital. Base Art has had artistic input into the infrastructure and design of the hospital from a detailed design phase, which means we're actually already been working with the architects around producing patient-friendly or empathetic design within our new hospital for this region. One of the areas where we've already had input into our new hospital in terms of design is in patient and family waiting areas. When I walk through the hospital, patient and families are often sitting what effectively looks like a bus stop. They're very exposed in their anxiety and perhaps grief if they're waiting for a loved one. So we've already worked with the architects to actually make recessed hubs where families can have that privacy while they're waiting in our hospital spaces. Another example that we've already had input into is in our surgical pathway. Often when a patient comes into a hospital for surgery, they are immediately taken away from the natural environment. So we've worked with an architect who loves light to actually build it into the patient journey so that they actually get exposure to ambient light and nature as they go through their surgical procedures and through our hospital. So we're really, really committed now to the patient experience and doing really empathetic design, which humanises hospitals in that way. So when I visited the CUSP exhibition, there was some pretty obvious relevance to Leah Heiss's work in terms of therapeutic object design, which is humanising medical technology, and it really puts the patient at the centre of the experience. And obviously George Coutts' work, he's already working in a hospital environment with his Bright Hearts app, which is actually putting young children who often go through repeated and painful procedures, looking at a biofeedback mechanism. And again, that really puts the patient in the position of control and power, and we're really interested in these sort of designers in this exhibition. So look, the really surprising aspect of the CUSP exhibition was the supercritical mass installation, which looks at sound as a design form. We have a really, really complex operating environment in a hospital, and we have a lot of problems associated with that complexity. A very well regarded phenomenon is called alarm fatigue. So what we have is patients are coming to harm as a result of our staff are becoming desensitised to the amount of alarms and beeps and chimes that they're actually hearing in their working day. So we have a lot of false alarms that staff need to attend to. And that desensitisation means that staff are actually not able to differentiate or cannot differentiate between an alarm that actually portends to a really serious critical event. We have been looking at this phenomenon for years, and we've put in all sorts of measures to actually overcome it. But when I walked through the supercritical mass installation, it really challenged the way that I was actually approaching this well-known phenomenon in our hospital environment of alarm fatigue. The supercritical mass installation really brought about this idea and challenged that question of, can design change the way that we listen? And as I walked through that installation, I was forced into it and then backwards upon myself to actually realise that what I was in was a collective oral experience. Now, when I apply that to our issue of alarm fatigue, I realised that we were not really asking ourselves the right questions in terms of how to overcome alarm fatigue, because we were not bringing in the collective experience between our staff and the patient and the general environment that we're actually designing. So supercritical mass has brought me to rephrase the question, can listening change the way that we actually design our new hospital? If we are listening from the point of view of the patient, we actually may find solutions to our alarm fatigue that we have been battling with for years. And in terms of designing our new hospital, we actually have the opportunity to work now with designers through our Base Arts program to find those solutions through the transdisciplinary approach, which means clinicians working with designers, working with architects, working with consumers to actually find. So this is a very provocative and challenging exhibition, and we have absolutely welcomed it to a regional hospital which is about to be built and have a major impact on the health in this area.